Hi everyone, I'm going to be talking today about the effect of poverty on health outcomes in children. One of the themes of healthcare disparity that we discussed a lot have been access and nutrition and education, and that's been the focus of a lot of the outreach we've done through our community class and whatnot. But I wanted to look at the environment of poverty and find research studies that examined more specifically the elements of the environment of poverty that contribute to specific healthcare outcomes for children. And so some of these are across the lifespan, so they're harder to measure, such as cardiovascular disease. But basically, we're looking at piecing out the elements that we can, so that we can attack them with more effective interventions and not feel as if the environment of poverty is sort of an intractable condition that we can't really attack. Obviously, we can't solve these huge economic problems, but we can try to extract an education for ourselves about what it means to live in this environment of poverty and what it does to people, and then how we can help as practitioners. So we're looking at malnutrition, lack of education, poor access, stress, violence, abuse, neglect, often transitions in the home where there's a single parent and then there's someone else in the home co-parenting, or just many people living in the home. All these things contribute to stress and sometimes instability, a feeling of not being safe. Those are all things that are components of this environment of poverty. So I use mostly qualitative studies, mostly cross-sectional qualitative studies, some mixed studies, because we're looking to really correlate the aspects of the environment of poverty to these healthcare outcomes. It's difficult without doing, a 50-year study to really look at the actual quantitative results, but they did do a lot of lab tests and whatnot to test for certain earmarkers or biomarkers for future cardiovascular disease in several studies. So I started with a study about preterm birth, and we started talking about environments where there are neighborhoods that are high poverty for long durations, have higher risks of preterm birth than other neighborhoods that are also high poverty but have not been high poverty for as long. And this was a theme that ran through several studies where the neighborhood itself seems to inform the results in terms of health outcomes for children. And so that's an interesting thing to kind of keep in mind when we're looking at how multidimensional the issue is and how not simple it is. So we looked at Wagramo did two different studies, one where he studied the effects of cardiovascular disease, poverty on cardiovascular disease outcomes, and then later on BMI and depression, all finding a correlation between children growing in poverty, even controlling for other elements such as parents' education, or even income within this poverty. It was just seen as anything less slightly above or below the poverty line was where we saw these negative outcomes. So we're looking at, so how do we identify a child at risk? And so there were studies that talked about, there's adverse childhood experience, which is ACE. There's studies that look at ACE and try to identify children who are in this situation. But then once we're there, so how do we help? So there was an interesting study that talked about food management behaviors in the home and talked about how the behaviors themselves, how much children are involved in preparation, sitting down at the table, talking about food, planning, structure, contributed to higher nutritional benefit for the children in the home, regardless of access, regardless of the specific financial situation of the family or the education or nutritional education of the parents, or the children. So it's interesting for us as clinicians to know that we have an option to sort of look at, in this particular instance, the food management behaviors of a family, which is something that we can work on and is not insurmountable or intractable condition. And lastly, I looked at this study that talked about nurses in a hospital in Africa where malnutrition causes a high mortality rate among very young children. And they found that the lack of education about the causes of malnutrition led the nurses to often blame the parents and not provide effective care because they felt that these were simple neglect cases and the children just needed to be fed. And obviously we know that that's not the case, but it's a good kind of model to look at for our own practice of not blaming the parents and really trying to endeavor to understand the more complex causes of why this environment affects children this way. So the end conclusion was we want to look to identify children in high-risk environments using the different tools that we have, understand the way that poverty manifests itself through the health outcomes of children in their childhood and through adulthood, and then implement meaningful interventions for this population. It's been a great semester. Thanks, everyone.